The vision for iTech Wales is universal healthcare, dental, mental wellness, social care, and global community initiative author, Neil Chinnock, Chief Business Administrator, iTech. Introduction: A vision for the post-Turing era, bridging digital integrity, human health, and global stewardship. The modern global economy has reached a historic, highly volatile, and deeply transformative inflection point, characterized by profound technological disruption, algorithmic opacity, and structural unpredictability. As global digital systems transition rapidly and irreversibly away from deterministic human-guided indexing mechanisms towards probabilistic, highly autonomous generative environments, the traditional metrics previously used to evaluate trust, authority, and systemic reliability have experienced massive and dangerous destabilization. We have entered the post-Turing era, a landscape where the boundaries between human-generated authenticity and machine-generated synthetic media are fundamentally blurred. In response to this expanding, borderless, and hazardous governance vacuum, the overarching vision of iTech Wales is to pioneer the FiduNode TM framework. This high-level governance architecture is meticulously designed to establish statutory accountability, verify human agency, and radically re-anchor truth, provenance, and trust across complex, multi-jurisdictional technological supply chains. At the absolute core of the FiduNode TM vision lies a fundamental, unyielding, and biologically grounded premise. Technological systems, regardless of their autonomy, computational power, or algorithmic sophistication, require verified, highly competent, and ethically bound human operators to act as the ultimate fiduciaries of digital integrity. The machine cannot perpetually police the machine. The ultimate safeguard of a civilized, functioning digital ecosystem is the human mind. However, the vision of iTech Wales recognizes a profound elemental truth that the vast majority of modern hyperscaled technology enterprises entirely and tragically overlook. Corporate responsibility, ethical stewardship, and systemic accountability cannot remain abstract concepts confined solely to technical protocols, software architecture, or algorithmic oversight. They must extend directly, meaningfully, tangibly, and compassionately into the physical and psychological world. An organization cannot reasonably demand elite cognitive performance, uncompromising ethical vigilance, and rigorous digital oversight from its human workforce. If those very individuals are burdened by physical illness, psychological burnout, unaddressed mental health conditions, or severe chronic anxiety regarding their family's fundamental well-being or the declining health of their elderly relatives. The mind that governs the machine must be housed in a body that is secure, healthy, and holistically protected. To achieve true institutional legitimacy and unparalleled operational excellence, the vision of iTech Wales encompasses the creation of a revolutionary, directly employer-provided universal healthcare, dental, mental health, and social care initiative. This initiative seeks to precisely mirror the statutory duty of care embedded within its digital frameworks by establishing a parallel physical supply chain of health security for its entire workforce and their broader familial networks. Crucially, this vision completely upends the traditional corporate healthcare model. Just as iTech Wales refuses to rely on unverified third-party data within its digital architecture, it absolutely refuses to outsource the physical and mental well-being of its people to disconnected, profit-driven third-party insurance underwriters. The vision is one of bold, uncompromising direct provision. iTech Wales will directly own the clinical facilities, procure the state-of-the-art medical equipment, and directly employ the elite medical, psychiatric, dental, and social care staff required to deliver this unparalleled standard of care. Yet, this vision extends far beyond the internal confines of traditional corporate human resources. A newly defined and absolutely central pillar of this initiative is a profound commitment to global citizenship and philanthropic reciprocity. One of the main reasons for this vision is to actively give back to the communities in each participating country that chooses to partner with iTech Wales. It is a formal acknowledgement that as digital technology transcends borders, so too must corporate philanthropy and ethical responsibility. The ultimate ambition is to leverage the success of the enterprise to establish direct, free at the point of service healthcare, comprehensive clinical dentistry, mental wellness hubs, elder social care, and advanced, secure technological access in developing countries that embrace the overarching digital paradigm. This comprehensive strategic exposition outlines the exact parameters of what this vision entails, the deep philosophical and strategic reasons why it exists, and the rigorous operational methodologies explaining how it will be achieved. It details the extensive architectural, demographic, philanthropic, and operational frameworks of an initiative that aims to establish a completely new global standard for corporate health benefits, multi-generational social care, international community stewardship, and technological empowerment in the modern era, creating a seamless, unbreakable alignment between digital accountability, global equity, and human physical and psychological well-being. Part 1. What services will be provided? The core philosophy of direct medical provision. To fully comprehend the structure, scope, and immense societal ambition of the iTech Wales healthcare vision, one must clearly define exactly what services are being provided, both to the internal workforce and to the broader global communities it seeks to uplift. The core offering is an innovative, entirely employer-funded and directly provided private healthcare network. iTech Wales will directly own the facilities, purchase the advanced diagnostic and medical equipment outright, and directly employ the clinical staff, from primary care physicians and specialist surgeons to dentists, clinical psychologists, and geriatric social workers. This vision explicitly adopts the founding philosophy and egalitarian ethos of the United Kingdom's National Health Service, NHS, providing world-class care that is entirely free at the point of delivery and allocated strictly on the basis of clinical necessity, but executes it through a proprietary, sovereign corporate infrastructure. Third-party suppliers and external private hospital networks will only be utilized as a temporary overflow mechanism or where highly specialized, ultra-rare tertiary care, such as complex neurosurgery, advanced transplantations, or rare oncological interventions, is specifically and unavoidably required to save a life. By insourcing the actual provision of medical care, iTech Wales eliminates the profit-driven friction, claim denials, and administrative opacity of the insurance industry, ensuring that clinical decisions are made solely between the iTech-employed physician and the patient. Under this direct provision model, the service is engineered to be entirely free at the point of service for all covered individuals. When an employee, a contractor, an eligible family member, or a recipient within a partnered developing community requires primary medical consultation, advanced diagnostic imaging, such as MRI, CT, or PET scans, acute hospitalization, specialist referrals, or complex surgical intervention within an iTech facility, there are absolutely no co-payments, deductibles, hidden excesses, or administrative fees required at the clinic or bedside. Financial friction is completely, deliberately, and permanently removed from the healthcare interaction. This total eradication of point-of-service billing is a deliberate psychological, economic, and medical strategy. It ensures that individuals never hesitate, ration, or delay seeking early medical attention due to personal financial considerations. By removing the terror of the medical bill, the initiative directly reinforces preventative health outcomes. Conditions that could evolve into catastrophic, debilitating, and vastly more expensive illnesses if left untreated are caught in their infancy, guaranteeing long-term operational continuity for the enterprise and preserving the dignity and quality of life for the individual. Clinical scope and the integration of dentistry. The scope of clinical coverage offered under the iTech Wales healthcare vision is expansively comprehensive, notably incorporating general medical care, full clinical dentistry, mental health, and social care into a single, unified, and indivisible ecosystem. Historically, dentistry has been treated as a segregated, secondary, and highly commodified tier within both public and private healthcare schemes across the United Kingdom and much of the developed and developing world. This artificial bifurcation has frequently led to widespread access deficits, deteriorating public oral health, undiagnosed maxillofacial pathologies, and significant out-of-pocket costs that cripple ordinary families, forcing them to choose between systemic healthcare and basic dental hygiene. iTech Wales entirely and unequivocally rejects this artificial and medically unsound separation. The corporate vision acknowledges the irrefutable, scientifically proven medical reality that oral health is intrinsically and deeply linked to systemic cardiovascular, metabolic, and psychological health. Untreated periodontal disease is a known amplifier of cardiovascular risk, systemic inflammation, and adverse diabetic outcomes. Chronic dental pain shatters cognitive focus, destroys productivity, and severely impacts an individual's psychological confidence and social functioning. Under the unified package, clinical dentistry is fully integrated alongside primary and secondary medical care. The mouth is no longer treated as a separate luxury entity from the rest of the human body. Because iTech Wales will directly employ elite dental surgeons and construct its own state-of-the-art dental surgeries, the dental component adheres strictly to a needs-based medical model, uncorrupted by aggressive upselling. It covers all diagnostic, preventative, and restorative procedures necessary to maintain absolute oral health, eliminate pain, and restore masticatory function. Covered dental procedures encompass routine clinical examinations, professional periodontal hygiene treatments, advanced diagnostic radiographs, high-quality composite and amalgam restorations, complex endodontic therapies to save compromised dentition, surgical extractions, and restorative prosthetics such as medically indicated crowns, bridges, and partial dentures. Delivered directly by iTech Wales employed dental professionals in proprietary clinical hubs, covered individuals experience immediate access to appointments and restorative materials without ever enduring the lengthy public waiting lists that currently plague the dental sector worldwide. The mental health fiduciary, ensuring psychological fitness. To demand that a workforce act as the ultimate fiduciaries of the global digital economy is to place an immense, continuous cognitive burden upon their shoulders. Monitoring autonomous algorithms, interpreting complex data provenance, and making high-stakes ethical decisions within the FiduNode TM framework requires total psychological clarity. An individual suffering from burnout, chronic depression, trauma, or severe anxiety cannot function as a reliable guardian of digital integrity. Therefore, a massive and unprecedented pillar of the services provided by iTech Wales is comprehensive, directly employed mental health support. The initiative treats psychological fitness with the exact same urgency and resource allocation as physical trauma. iTech Wales will directly employ clinical psychologists, cognitive behavioral therapists, psychiatrists, and wellness coaches within its healthcare hubs. Staff and eligible family members will have frictionless, zero-wait time access to confidential therapeutic support. This includes regular mental fitness evaluations, trauma-informed counseling, psychiatric prescribing, and proactive burnout prevention programs tailored to the unique stressors of the technology sector. By mitigating algorithmic burnout, the unique cognitive exhaustion associated with managing high-velocity data environments and autonomous systems, iTech Wales ensures that the minds governing the global digital infrastructure remain sharp, resilient, and deeply healthy. This psychological duty of care acknowledges that mental well-being is the absolute bedrock of ethical reasoning and technological innovation, entirely eradicating the stigma traditionally associated with seeking mental health support in high-performance corporate environments. Social care and well-being for the elderly. A visionary corporate duty of care must acknowledge the profound shifting demographics of the modern world. The current global workforce is increasingly trapped in the sandwich generation, individuals simultaneously trying to raise young children while managing the declining health and complex social needs of their aging parents and grandparents. The immense stress, logistical nightmare, and financial ruin associated with navigating fractured, inadequate public elder care is a silent epidemic that destroys employee focus and shatters familial stability. To create a truly multi-generational shield of protection, the iTech Wales vision expands its services to include comprehensive social care and well-being support for explicitly named, eligible elderly extended family members. Through its directly employed medical and social care workforce, iTech Wales will provide domiciliary care, visiting occupational therapists, and geriatric nursing support for registered elderly dependents. This encompasses dedicated geriatric medical care, preventative cognitive decline monitoring, mobility support, and directly employed community nursing staff who can perform home visits. Furthermore, iTech Wales will leverage its technological prowess to integrate FiduNode, TM, secured smart home monitoring systems into the residences of elderly dependents. This allows for privacy-preserving, secure monitoring of vital signs, fall detection, and automated medication dispensing, ensuring that elderly family members can age in place with dignity. By taking the crushing burden of social care off the shoulders of its employees, iTech Wales protects the lineage and secures absolute, undivided organizational loyalty, proving that corporate care is forged by protecting the entirety of an employee's human experience. The absolute non-cosmetic boundary. To maintain absolute financial sustainability, strict operational fairness, and complete alignment with the philosophy of true health security, what the initiative covers is defined by an absolute, uncompromising, and permanent clinical boundary. Coverage is restricted purely to non-cosmetic treatments. Zero cosmetic procedures are offered, facilitated, subsidized, or performed within iTech Wales facilities under any circumstances whatsoever. In the context of general medicine, elective aesthetic plastic surgery, non-functional cosmetic enhancements, unproven vanity therapies, and lifestyle treatments without a rigorous clinical evidence base are explicitly and permanently excluded. In the context of dentistry, purely aesthetic procedures such as elective tooth whitening, cosmetic porcelain veneers designed solely to alter smile aesthetics without functional benefit, and non-clinically indicated alignment or orthodontic procedures are similarly and strictly excluded. This objective boundary establishes a clear, transparent, and legally defensible parameter based entirely on verifiable medical, dental, and psychological necessity. If a treatment is required to diagnose, treat, manage, or rehabilitate an illness, injury, deformity, congenital defect, mental health disorder, or painful dental condition, it is fully covered and remains entirely free at the point of delivery. If a treatment is elected purely to alter physical appearance without any underlying functional or clinical need, it falls completely outside the fiduciary scope of the scheme. This rigorous distinction is vital for multiple reasons. Firstly, it ensures that corporate financial resources, philanthropic funds, and the invaluable time of directly employed clinicians are concentrated entirely on genuine human healing, health restoration, and preventative physical and mental care. Secondly, it prevents the severe dilution of resources through elective aesthetic expenditures, which are notoriously prone to unpredictable cost inflation, subjective patient dissatisfaction, and exceptionally high rates of revision procedures. By maintaining this absolute boundary, iTech Wales ensures the initiative remains an unbreakable shield for human well-being and longevity, rather than a subsidized vehicle for vanity. Part 2. Why this vision exists: a covenant of reciprocity and giving back to partner communities. While employee retention, talent acquisition, and domestic corporate resilience are powerful drivers, the vision of iTech Wales extends far beyond internal human resources and the borders of its home nation. One of the most fundamental, driving, and deeply held reasons for this vision is a profound moral and strategic imperative to give back to the communities in each participating country that chooses to partner with iTech Wales. As the FiduNode TM architecture scales internationally to govern digital trust and secure algorithmic supply chains, it will inevitably integrate with the infrastructural, legal, and regulatory systems of developing nations. Historically, the expansion of multinational technology companies into emerging economies has been defined by an extractive neo-colonial mindset. Global tech firms frequently utilize local technical talent, leverage lower operational costs, extract vast amounts of regional data, and secure lucrative market share while repatriating the vast majority of the profits and technological benefits back to their home jurisdictions, leaving minimal lasting, life-altering social infrastructure behind for the local populace. iTech Wales entirely and aggressively rejects this extractive model of global technology expansion. The vision of iTech Wales is built upon a covenant of absolute reciprocity. If a developing nation agrees to become a National Digital Security Industry Authority, NDSIA, participant country, adopting the rigorous standards of the FiduNode TM framework to secure their national digital economy, iTech Wales believes that the partnership must be holistically uplifting. In exchange for this digital integration, iTech Wales is committed to investing directly in the physical and social fabric of that nation. The primary objective is to establish free at the point of service healthcare, comprehensive clinical dentistry, elderly social care provisions, and advanced technological infrastructure, not just for direct corporate employees in these countries, but to build, fund, direct, and maintain medical infrastructure that gives back directly to the broader local partner communities. In developing regions where access to primary medical care, safe maternal health services, psychiatric support, and hygienic clinical dentistry is often a luxury reserved solely for the ultra-wealthy or the political elite, the introduction of an iTech-funded direct provision healthcare network is nothing short of transformative. By building local clinics, directly employing local medical professionals at highly competitive local rates, and ensuring that community members interacting with the iTech ecosystem have access to zero-cost, high-quality medical, mental, and dental intervention, the company actively raises the baseline standard of living. This is not corporate philanthropy deployed as a superficial public relations exercise. It is structural, foundational socio-economic investment. It proves that technological advancement and global digital security can, and absolutely must, be directly tethered to the eradication of health inequity and human suffering. Eradicating the dental and mental health crisis in emerging economies. The crises of dental care and mental health in developing nations are particularly acute and often entirely neglected by traditional international aid programs, which typically prioritize infectious disease control while ignoring the silent, crippling epidemics of untreated maxillofacial pathology and psychological trauma. In many regions, the total absence of restorative dentistry condemns millions to a lifetime of chronic pain, severe nutritional deficits due to masticatory failure, and life-threatening systemic infections originating from untreated dental abscesses. Concurrently, populations suffering from systemic poverty or conflict are completely devoid of psychological support networks. The iTech Wales vision aggressively addresses these blind spots. By establishing fully equipped modern dental surgeries and mental health clinics alongside primary medical facilities in partner communities, the initiative provides not merely emergency extractions, but comprehensive, preventative, and restorative clinical dentistry, alongside trauma-informed psychiatric care. Furthermore, iTech Wales is committed to upskilling local healthcare capacity. By directly employing and training local practitioners using the advanced, ethical frameworks established by the company, iTech Wales ensures a lasting transfer of medical and technological knowledge, permanently elevating the sovereign medical capabilities of the partner nation. Technological empowerment as a pillar of public health. Furthermore, The commitment to giving back to developing countries involves the integration of cutting-edge technology to leapfrog traditional healthcare and educational barriers. The why of this vision is heavily predicated on the understanding that securing digital data and securing human health are inherently synergistic endeavors. One cannot truly flourish without the other. Digital security cannot exist in a vacuum of physical poverty, untreated mental illness, and rampant disease. When iTech Wales establishes these free at-the-point-of-service clinics in developing NDSIA participant countries, it will simultaneously deploy its advanced technological infrastructure to support these communities. In many developing nations, the primary barrier to effective healthcare is not merely a lack of physicians, but a severe lack of secure, reliable data infrastructure, leading to fragmented patient histories, lost diagnostic imagery, and fatal medical errors. iTech Wales will utilize the underlying principles of its digital fiduciary frameworks to establish highly secure, cryptographically protected electronic health record systems and telemedicine platforms for these partner communities. By providing the physical technology hardware, installing secure broadband networks, outfitting its direct provision clinics with advanced diagnostic equipment such as digital dental radiography and portable ultrasound, and deploying the software architecture to safely manage patient data, iTech Wales equips developing nations with a 21st-century medical infrastructure. Crucially, by integrating the high-level security principles of the FiduNode (TM) framework, patient data in developing countries is protected with the same cryptographic rigor as corporate data in the West, preventing exploitation by data brokers. This ensures that a local doctor in an emerging economy can consult on a complex case with a global specialist employed by iTech Wales in real time, reviewing secure, unalterable digital X-rays and health records. By providing elite technology alongside direct healthcare provision, iTech Wales addresses both the digital divide and the medical divide simultaneously. Enhancing medical intervention across the United Kingdom. Before expanding globally to developing nations, the vision focuses heavily on its domestic roots. Another primary reason for this vision is the explicit ambition to radically enhance medical intervention throughout the United Kingdom. As the birthplace of this initiative, the UK serves as the domestic baseline and operational proving ground. By establishing a robust, highly efficient, directly employed private network for its workforce, their extended families, and elder dependents, iTech Wales aims to actively relieve the compounding demographic, financial, and post-pandemic pressures currently facing the domestic public health infrastructure. The National Health Service in the UK is a historic triumph and a pillar of the welfare state. Yet it currently bears the immense weight of an aging demographic, severe surgical backlogs, overwhelmed mental health trusts, a deepening crisis in NHS dentistry access, and the collapse of adult social care. By transferring a significant cohort of individuals, comprising direct employees, independent contractors, multi-generational family members, and the elderly requiring social care, into a privately funded, directly operated zero-wait time system, iTech Wales directly removes thousands of patients from local NHS waiting lists and social care queues. It frees up public hospital beds, reduces the queue for general practitioners, drastically reduces the burden on local NHS dental practices, and relieves local councils of immense social care burdens. Furthermore, by proving definitively that a corporate entity can sustainably build, staff, and fund a comprehensive, non-cosmetic, needs-based health, mental health, and social care system that is entirely free at the point of service, iTech Wales sets a revolutionary and disruptive precedent for corporate responsibility in the UK. It elevates the baseline of what is expected from top-tier employers in the modern age, proving that the accumulation of corporate wealth and technological success must be translated into direct, tangible medical and social interventions. This vision transforms the traditional corporate benefits package from a superficial recruitment perk into a vital pillar of national public health resilience, proving that businesses can be active, powerful, and direct participants in public health solutions rather than passive beneficiaries of state infrastructure. Strategic alignment and the legitimacy-based view. From a high-level strategic management and academic perspective, the why underpinning this entire global vision is deeply rooted in the vital shift away from the outdated resource-based view towards a highly robust legitimacy-based view. In contemporary corporate strategy, organizations have historically relied on hoarding proprietary technical assets, closed software ecosystems, vast data sets, or physical hardware to maintain a competitive advantage. However, in an era defined by rapid algorithmic automation, open-source generative systems, and shifting digital landscapes, basic technical capabilities are rapidly commodified. The hoarding of technology no longer guarantees survival or market dominance. The true competitive advantage in the modern marketplace now depends entirely on verifiable moral trust, institutional legitimacy, and demonstrable adherence to a strict, uncompromising duty of care, both to employees and to the world at large. The FiduNode TM framework advocates for exactly this kind of verified accountability, structural transparency, and ethical stewardship in the digital realm. The iTech Wales Direct Provision Healthcare, Mental Health, Social Care, and Global Community Initiative is the direct, undeniable physical translation of those digital principles. By establishing a directly employed, vertically integrated healthcare system that guarantees physical security, mental health resilience, early disease prevention, multi-generational family protection, including dignified elderly care, and profound global community reinvestment, the company achieves supreme institutional legitimacy. It demonstrates, without question, that its stated commitment to human agency, ethical oversight, and systemic protection is not a performative marketing gesture or empty corporate rhetoric, but a deeply embedded operational reality that dictates every single facet of corporate behavior. This initiative directly resolves the intense psychological pressures inherent in high-technology enterprises operating at the absolute frontier of digital innovation. As digital governance standards become more demanding and public scrutiny of artificial intelligence intensifies, human operators face immense cognitive pressure to perform flawlessly, spot algorithmic drift, and exercise perfect ethical judgment. The mental load of managing global AI risks is staggering. By insulating these workers with an unbreakable multi-generational health and social care shield, iTech Wales eliminates a massive, ubiquitous, and highly distracting source of personal anxiety. This unparalleled peace of mind enables its workforce to execute their professional duties with complete clarity, independence, and focus, entirely free from the distraction, depression, and despair of medical financial worry. It replaces the pervasive modern anxiety of talent attrition, gig economy exploitation, and burnout with deep, multi-generational organizational loyalty. Employees who know that their employer directly employs the doctors saving their child's life, the dentists treating their spouse, the psychiatrists preserving their mental health, and the social workers preserving the dignity of their aging parents do not leave. They invest their entire creative and intellectual capacity into the success of the enterprise. Part 3. How the vision will be operationalized: direct employment, demographic architecture, and internal funding. Executing a vision of this unprecedented scale, generosity, and global reach requires a meticulous, structurally sound explanation of how it will be sustainably funded, governed, and rigorously administered. A central innovation in how iTech Wales achieves this lies in its absolute rejection of the traditional third-party insurance model. Instead of paying exorbitant, profit-padded monthly premiums to global insurance underwriters who routinely deny claims to protect their margins, iTech Wales establishes a direct fiduciary healthcare provider model. iTech Wales will establish its own internal, highly capitalized health trust. It will use corporate revenues to directly construct, acquire, or lease physical medical facilities, and it will directly employ the physicians, dentists, psychiatrists, and social workers. By eliminating the insurance middleman, iTech Wales ensures that clinical decisions are made flawlessly and immediately based on the patient's needs rather than a third-party underwriter's profit algorithms. Third-party suppliers will only be engaged where specifically required by jurisdictional law, or where ultra-rare, hyper-specialized tertiary care falls temporarily outside the direct capacity of the iTech medical hubs. To achieve sustainable equilibrium within its corporate operations, how iTech Wales intends to structure this vision relies on a highly specific, mathematically sound, two-tiered demographic framework that defines eligibility, funding responsibilities, and inclusion parameters with absolute precision. Tier 1, the core fully funded demographic. The primary tier of the healthcare scheme represents the direct, fully funded corporate commitment to the core workforce and their immediate nuclear families. This foundational tier is funded entirely by iTech Wales, with zero financial contribution, copay, salary sacrifice, or premium deduction required from the employee at any stage. To qualify for this primary tier of coverage, an individual must be actively employed on a formal full-time or part-time basis by iTech Wales or any of its officially incorporated subsidiary companies globally. Furthermore, this fully funded coverage extends automatically and unconditionally to the employee's legally married spouse, established through valid civil marriage documentation. It also provides unconditional Day 1 coverage to all biological sons and daughters, legally adopted children, and stepchildren of the direct employee. For all individuals qualifying under this core tier, iTech Wales acts as the ultimate provider of care. The company absorbs the entire cost of treatment by utilizing its own directly employed clinical staff and proprietary medical facilities. By internalizing the cost of care, the company ensures that an employee's focus is never derailed by a child's sudden illness, a spouse's medical emergency, or the staggering costs of psychiatric support. Tier 2, strict eligibility for the extended ecosystem, elderly care, and the gig economy. While the primary tier fiercely protects the core workforce, the vision of iTech Wales recognizes that modern, agile technology organizations do not operate in a vacuum. They operate within dynamic, broader ecosystems that rely heavily on direct contractors, NC personnel, and extended familial support structures. The modern gig economy has frequently left contingent workers highly vulnerable, stripped of the protections afforded to traditional employees. Furthermore, the need for elderly social care frequently falls entirely upon the shoulders of the working employee. To extend the protective umbrella of the healthcare network without imposing unbounded and unsustainable financial liabilities upon the enterprise, the company has designed an innovative secondary, self-funded tier, Tier 2. This tier operates as a formal, highly regulated opt-in extension, allowing participating individuals to gain full access to the elite, iTech-operated clinical hubs, the dedicated social care teams, and the revolutionary cross-border clinical pathways. However, the monthly subscription charge for these participants is paid entirely by the individuals themselves. Crucially, these payments do not go to a third-party insurance broker. They go directly into the internal iTech Health Trust to cover the operational costs of the direct provision network. Eligibility for this secondary tier is governed by strict, uncompromising structural rules designed to maintain the legal and administrative integrity of the clinical system. Agency staff and independent contractors are eligible to subscribe, provided they hold a valid, direct contract or a formal job permit directly with iTech Wales or its subsidiaries. To prevent administrative dilution, the exploitation of the system by unconnected third parties, and unbounded network sprawl, this eligibility explicitly and strictly excludes subcontractors of those primary contractors. The relationship to the iTech Wales entity must remain direct, audited, and mathematically verifiable. iTech Wales refuses to ensure individuals hidden behind opaque layers of subcontracting. Accountability and identity must be absolute. Additionally, this self-funded tier allows direct employees to enroll explicitly named members of their extended family, most notably grandparents and aging parents, into the protective network. This is the exact mechanism through which the elderly social care and domiciliary support elements are administered. To prevent adverse selection, administrative ambiguity, and fraudulent ghost enrollment, every extended family member enrolled in this tier must be explicitly and individually named, rigorously verified through FiduNode (TM) identity protocols, and registered exclusively during formal annual enrollment windows. This two-tiered architecture creates a highly equitable, inclusive, yet financially guarded corporate ecosystem. Direct contractors and agency workers are empowered to purchase elite, private health, mental, and dental security directly from iTech Wales at highly advantageous, at-cost group rates that they could never access on the open individual market. Simultaneously, direct employees are granted the profound psychological comfort of securing the health and social care of their extended lineage. Knowing that one's parents have guaranteed access to dignified social care and one's grandchildren have guaranteed access to free at-the-point-of-service dentistry creates an unbreakable psychological bond between the employee and the enterprise that transcends traditional employment perks. Economics of direct provision over extractive insurance. Operating a universal, cross-border healthcare, mental health, and social care initiative of this sheer magnitude requires a radical departure from traditional corporate benefit structures. Traditional models rely heavily on paying exorbitant premiums to third-party insurance conglomerates. However, insurance companies are inherently designed to extract profit margins by aggressively limiting payouts, delaying treatments, and introducing complex bureaucratic friction into the doctor-patient relationship. iTech Wales intelligently mitigates systemic cost inflation by bypassing the extractive insurance middleman through its direct provision model. The financial contributions generated from the self-funded participants in Tier 2, such as direct contractors and individually named extended family members, do not vanish into the profit pools of an external underwriter. Instead, these subscription revenues are injected directly back into the iTech Wales medical division. By retaining health capital internally, iTech Wales creates a self-sustaining clinical ecosystem. Tier 2 subscriptions actively and directly fund the physical expansion of proprietary clinics, the procurement of advanced diagnostic hardware, such as MRI suites and digital dental scanners, and the salaries of the top-tier medical personnel, psychologists, and social workers directly employed by the company. This creates a highly efficient, mutually beneficial financial structure that protects the corporate balance sheet, eliminates insurance profit leakage, and maximizes the human benefit for all participants by ensuring every penny is spent purely on clinical infrastructure and patient care. This operational stability is heavily and deliberately reinforced by the profound economic emphasis on preventative clinical interventions. The business case for preventative medicine is incontrovertible. By providing employees, contractors, their families, and partnered communities with frictionless, completely free access to routine dental checkups, proactive cognitive behavioral therapy, early diagnostic imaging, and primary practitioner consultations, health issues are detected and resolved at their absolute earliest, cheapest, and most manageable stages. Early restorative dental treatment prevents complex, highly expensive maxillofacial surgeries weeks later. Proactive mental health care prevents total psychological collapse and prolonged absenteeism. Early medical screening identifies systemic disease before it results in catastrophic hospital admissions. Preventative, directly provided care maintains a fundamentally healthy population, ensuring the unbreakable long-term financial viability of the entire global scheme. Transparent philanthropic funding via smart contracts. To guarantee that the philanthropic investments directed towards building clinics in these developing communities are entirely immune to local corruption, administrative friction, or bureaucratic inefficiencies, iTech Wales will leverage the advanced smart contract capabilities inherent within the FiduNode TM architecture. Funding for the community health and technology trusts will not be dispersed through opaque, traditional charitable channels. Instead, Financial resources generated by corporate revenues will be executed via cryptographically secure, automated smart contracts. These contracts release funds to local partner clinics, construction teams, and infrastructure projects only when verifiable, mathematically proven milestones are achieved, such as the verified delivery of patient care, the successful installation of local broadband networks, or the deployment of certified dental equipment. This ensures absolute, indisputable financial transparency, guaranteeing that every single penny allocated for community uplift goes directly into the physical provision of clinical care, social work, and technological empowerment, completely immune to local malfeasance. Because iTech Wales is directly building the infrastructure rather than handing cash to third-party charities, it maintains absolute quality control. iTech will construct the clinics, install the secure broadband, and directly employ the local doctors, dentists, and nurses at highly competitive, dignified local wages. This ensures absolute, indisputable financial transparency and stimulates the local economy by creating high-quality, stable medical and technological employment for the host nation's citizens. Part 4. How the vision will be operationalized. Domestic origin, international expansion, and borderless interoperability. How this immense vision becomes a physical reality relies on a highly disciplined, phased, and deeply pragmatic rollout strategy. The operational deployment of the iTech Wales Direct Provision Healthcare Initiative is strategically designed to follow a realistic, grounded trajectory that directly mirrors the commercial growth and operational footprint of the company's core digital business. The initiative does not begin as a speculative, overextended global network built on debt. Rather, it originates as a highly focused, robust, and impeccably managed domestic operation rooted firmly within the United Kingdom. The UK domestic baseline. In this foundational phase, iTech Wales will acquire, build, and staff its proprietary clinical hubs within the United Kingdom. iTech will directly employ the GPs, dental surgeons, psychiatrists, and social care workers required to service its domestic workforce. Only for highly specialized tertiary care will iTech strategically contract with external third-party specialists until the internal infrastructure achieves the scale necessary to bring those specialties in-house. This domestic deployment serves as a crucial operational foundation. It allows the company to refine its direct provision clinical pathways, test the administrative integration between the fully funded and self-funded tiers, perfect its domiciliary social care networks for the elderly, perfect its proprietary electronic health records systems, and rigorously evaluate physical, mental, and social care outcomes across the UK workforce before any borderless scaling is attempted. By actively enhancing medical intervention throughout the UK first, creating physical medical capacity where none existed, iTech Wales establishes a flawless operational baseline and immediately solidifies its reputation as an employer of absolute choice. Conditional international expansion to NDSIA participant countries. A defining characteristic of this strategic vision is its strict adherence to commercial realism and conditional scalability. The healthcare initiative will expand internationally if, and strictly only if, the overarching FiduNode TM project achieves formal international commercial success and widespread global adoption. The geographical expansion of the healthcare infrastructure and the subsequent community give-back programs is hard-coded entirely to this specific commercial trigger. When iTech Wales successfully incorporates a subsidiary in a new NDSIA participant country to support the FiduNode TM architecture, the direct provision healthcare model will immediately be initialized in that specific jurisdiction. The company will acquire real estate, build local iTech clinics, and directly employ local clinical staff, ensuring that local employees and the partner communities benefiting from iTech's philanthropic infrastructural investments receive the exact same superlative standard of directly provided healthcare, psychological support, and dental coverage, constructed on the identical foundational principles of clinical necessity and zero cost at the point of delivery. This strict conditionality ensures that the massive infrastructural investment required for healthcare provision remains financially tethered to the revenue-generating success of the core business, preventing unsustainable overextension while incentivizing global growth and community support. Borderless clinical interoperability and iTech centers of excellence. The true paradigm-shifting innovation of how this conditional international expansion model operates lies in its capacity for borderless clinical interoperability, establishing a healthcare system that is genuinely internationally free at the point of service. In a highly globalized economy, medical availability, surgical wait times, technological capabilities, and specialized treatment capacities vary dramatically across different sovereign nations. Under the proposed international iTech healthcare network, NDSIA participant countries form an interconnected, seamless, and frictionless clinical ecosystem of iTech-owned facilities. Because iTech owns the facilities and employs the staff, cross-border patient transfer is completely insulated from the bureaucratic nightmare of international insurance claims. If a specific type of non-cosmetic medical, psychiatric, or dental treatment is clinically indicated for a covered employee, a contractor, a verified family member, or a community beneficiary, but the local iTech clinic lacks the highly specialized equipment or expertise to perform it, the system actively allows them to travel overseas to receive that care in an iTech center of excellence located in another participating country. For example, if an employee in a developing NDSIA participant country requires a highly complex orthopedic procedure, intensive inpatient psychiatric rehabilitation, or a complex restorative dental reconstruction that local infrastructure cannot yet adequately support, but that exact procedure is readily available within an iTech-owned medical center of excellence in the UK or mainland Europe, the healthcare scheme enables secure, fully coordinated cross-border medical transfer. The internal iTech Health Trust absorbs the costs of the overseas clinical treatment, the specialist surgical intervention, and the hospital stay in full, remaining completely free at the point of delivery for the patient. This unprecedented cross-border capability transforms the employer-operated benefit into a truly global health shield. It ensures that personnel, their elderly dependents, and partner communities are never trapped by local clinical bottlenecks, infrastructural failures, or regional healthcare disparities. By leveraging the technological infrastructure of the FiduNode (TM) framework to securely manage health identity, electronic health records, and cross-border treatment verifications, iTech Wales effectively eradicates geographical health borders for its workforce, delivering a standard of care previously reserved solely for the ultra-wealthy. Conclusion: realizing the vision of the physical and psychological fiduciary, the vision of the iTech Wales Universal Healthcare, Dental, Mental Health, Elder Care, and Global Community Initiative represents a profound, necessary, and unapologetically ambitious evolution in corporate governance, human resources, societal well-being, and global community partnership. As the global digital economy continues to accelerate and automate at a breathtaking pace, the temptation to view human workers as disposable cognitive assets, to ignore the mental toll of digital oversight, to abandon the elderly to failing social systems, and to view developing nations merely as data harvesting grounds poses a grave existential threat to organizational integrity, human rights, and international societal trust. By extending a rigorous, uncompromising, and deeply compassionate duty of care into the physical and psychological domains through a robust direct delivery model, iTech Wales creates a unified, holistic environment of protection that perfectly mirrors the stringent accountability demanded by its digital innovations. By detailing exactly what services will be directly provided, why they are a strategic, economic, and moral necessity for enhancing UK and international medical interventions, particularly in developing partner nations, and how they will be sustainably self-funded and conditionally scaled without reliance on extractive third-party insurance brokers, iTech Wales outlines a flawless execution strategy. Offering comprehensive medical, psychiatric, and clinical dental care, along with dignified elder social care that is absolutely free at the point of service, allocated strictly on the basis of clinical need, and bounded purely by non-cosmetic parameters, honors the finest egalitarian traditions of public health while harnessing the swift excellence and technological sophistication of direct private enterprise. Furthermore, the commitment to build clinics and deploy advanced technology in developing nations ensures that technological progress and human health equity remain inextricably linked. Beginning as a robust, highly effective domestic baseline designed to immediately enhance medical intervention throughout the United Kingdom by building physical, state-of-the-art facilities and primed to scale globally to NDSIA participant countries if, and strictly only if, the FiduNode (TM) project achieves international commercial success, this initiative establishes a completely new gold standard for global employer benefits. By fundamentally committing to giving back to partnering communities through the direct establishment of free healthcare, dentistry, mental wellness, elder care, and technological access, iTech Wales transcends the traditional extractive boundaries of a technology corporation. It creates an international, proprietary healthcare ecosystem free at the point of service, shielding employees, direct contractors, agency personnel, multi-generational families, from the newborn to the elderly, and vulnerable global communities under an unbreakable umbrella of physical and mental health security. Ultimately, this comprehensive vision demonstrates to the world that the most powerful, enduring competitive advantage in the modern era is not a proprietary algorithm or a passive insurance policy, but an unshakable, vertically integrated, and deeply human commitment to dignity, uncompromised trust, and the total physical and psychological flourishing of the global communities that build and sustain the future. Thanks for watching.